Welcome to the Health Desk, your trusted health and wellness program on the Oracle Television Network. Today is that day that we talk about those silent killers, those diseases that you walk silently with them, they don't show any symptom, they just come quietly, but kumbe wakati una realize it is much worse and it is erupting. That is why we thought it better for us to bring it here and we turn them back a deep, that much deep, so that we know how do we know these things that is happening, how do we diagnose that we are suffering from this, when do you know that you're supposed to be going to see the doctor, and what is the right and perfect time for you to do that. And to join me so that we can do that is none other but Dr. Teresia, we call Dr. T. So nataka ajiintroduce mwenyewe, atuambie unampata wapi, na utampata aje, na ndo nisikupatie ile information ambayo sio hiyo. Since ako hapa, karibu sana daktari, tuambie watakupata wapi, unaitwa nani, na ndo tuendelee.
Thank you. I'm Dr. Teresia Naliaka, a medical doctor by profession. I am a health and wellness advocate, very passionate about public education. Yes, so my Instagram handle is Dr. Ndenya, and X, it's Des. Yes.
Yeah, thank you so much for making time to come here. We do not take that for granted.
Thank you so much for giving me this opportunity.
Karibu, karibu. And before we begin, you know, the best part for it is you becoming a partner of Oracle TV. There's nothing much better than you becoming that supportive system, that person that when you're out there, you're saying I'm an ambassador for Oracle TV. And when an ambassador for Oracle TV, that means you are part and parcel of what is happening right here at Oracle TV. You know everything that happens in Oracle TV. You love the programs, you love the sermons, you love everything that we do right here. And out there, you're telling people, if you want to get transformed, if you want your future to be bright, watch Oracle TV. And for us to be on air 24/7, for us to be on air every time you're looking for us, every time umetembea umerudi ukajiambia, I want to be educated, I want to be informed, you switch on your TV and you watch Oracle TV and your life get transformed, your family's life get transformed, your friend's life get transformed. It is because of you partnering with Oracle TV. And for you to partner with Oracle TV is very simple. You go to your M-Pesa number, pay bill is 171133, account is Oracle TV. Pale kwa amount, hapo kwa amount nakwambia nisikufinye any amount that you feel that I want to become a blessing with this certain amount. Whatever you feel, if it is 500, 1,000, 10,000, 100,000, there's nothing like little money. Ama hiyo yangu ni kidogo haitajaza. That which God has helped you to get, when you support Oracle TV, you make sure that somebody somewhere's life is being transformed. Somebody somewhere, a destiny is being transformed. So keep on partnering with us through that pay bill number. It will be running throughout the whole program. So partner with us and make sure that when you're watching us live on the Oracle Television Network Facebook page, na pale YouTube, the Oracle Television Network, share the link, share the live, so that everybody will get to know what is this silent killers and how do they come in. How do I know that nimefika kilele? It is time for me to act up. It is time for me to start doing what I'm supposed to be doing. So pale live, tuanze share the live. Let us share the live. And of course, if you have a question for the doctor, make sure you comment up kwa comment section below and send in your SMS on 0711 176 006 and we'll be glad to answer your question. Na tuta make sure that kama zitakuwa mingi sana, tutaleta daktari tena aweze kumalizia hizo maswali. And of course, keep on partnering kuanzia sasa mpaka pale tutakapomalizia, and the good Lord will bless you. To kick us off, daktari.
Yes.
You know, most people, they talk about these silent killers. Why are high blood pressure and diabetes commonly referred to as silent killers?
Okay, so high blood pressure and diabetes are normally asymptomatic. So you find that patients have these diseases and they don't know. they go to the hospital only when they have symptoms or the complications. Have you ever heard of these people say, Ati, yeah, my relative was just walking and he collapsed.
Yeah, so many times.
Yeah, and they say, Ati, the person had stroke. He
Mm-hmm.
had undiagnosed hypertension. Yes, so these diseases are very, very serious and they're very asymptomatic. By the time you develop symptoms, you already have complications. Yes, that's why they're called silent killers. Yeah.
Wow, so what is exactly is high blood pressure and how does it affect the body? Because we've said they don't have symptoms. So for somebody to now know there's something wrong with me, what is high blood pressure?
So, you see, in your body to function normally, your body needs nutrients and oxygen. And how do the organs in your body get this? They get this by the blood, which is pumped by the heart. So, high blood pressure is when this pressure of this blood is higher than the normal, which is 120/80. Yes, I know most people know that.
Yeah.
Yeah. So when this pressure is elevated, it's actually very detrimental to your organs. For example, your eyes, your kidneys, your heart, and even your brain.
That means somebody will not be seeing well.
Yeah, you have blurry vision. You can even be blind. Yes.
But many people say they are healthy, but can somebody have high blood pressure and not know it?
Yes. A majority of the patients who are diagnosed with hypertension, or let me say high blood pressure.
It's one and the same thing.
Yeah, it's the same thing.
Okay.
These people are diagnosed through routine medical checkups. Maybe you find them that they go to the hospital when they have other conditions. And if you've noticed, every time a patient goes to the hospital, or you yourself, you've gone to the hospital, you first go to the triage, they take your weight, your height, and they measure your blood pressure.
Yeah.
From there, yes. So you may find a person maybe like, how do I say this, go like 3 times consecutively, your pressure is above 120. You see the nurse will be, your pressure is high. Maybe it's at around 129, 135. And that's when you'll see the doctor will diagnose you with high blood pressure. So like, it's not a disease that you can diagnose at all because you have symptoms like your headache, whatnot. It's only through measuring your blood pressure.
Oh, so there's nothing else you can do. That is the only
way
thing
to know. Yes.
Okay. And maybe are there major factors that actually contribute to somebody having this high blood pressure?
Oh, yes. For example, we have a family history. Have you ever had maybe a person is saying, my grandfather had high blood pressure, my brother has high blood pressure. In such a family, the members are at a high risk of getting the hypertension. There's also habits like smoking, excess alcohol intake, and there's also some diseases. Like there's a tumor, it's called pheochromocytoma.
Hey, what? What is that?
That's a tumor, how do I say this? It's a tumor in a gland known as adrenal gland. That organ is like located above your kidney. So like it secretes hormones.
Okay.
Yeah.
Okay, so those can lead hakuna factor. So this person, let's say for example, for those people, because what one don't drink, don't do this, it will increase. So for a person who is clean, record it's clean, this person does not smoke, this person does not drink, are they at the risk of getting high blood pressure?
Yeah, if you have that family history, and also a major factor, age.
Oh. At what age do you like feel like when I'm this certain age, this is the point that I'll know that I am at a high risk? Watu wa age gani? Ama ukiwa age certain, unajua mimi, I'm okay.
Actually, you can never be okay. Can never be okay. Because at age 40 and above, have you ever noticed most grandparents have high blood
Blood
pressure.
pressure, yeah.
I don't think I have ever seen an old person who
does not have.
Yeah, like rarely.
Okay, and if this person who has high blood pressure stays for long without being treated, what will happen?
What would happen is, like what I said at first, the high blood pressure can put a strain in the blood vessels and even damage them. The blood vessels are leading to your eye, so you can have blood vision, you can be blind.
Oh,
Yes, and the blood vessels leading to your kidney, because they're very fragile, very tiny, and this can lead to kidney scarring, kidney failure.
also
and,
those people who have kidney failures, most of them is due to high blood pressure.
Not exactly, like there are a number of risk factors also
Okay.
for that. Yes.
Okay, continue.
Okay, yes.
The risk factors you're saying for this person who's being treated.
The risk factors for a person getting hypertension. Yes. And also, there are women who, I don't know, do you have a child?
Not yet.
Yes, so like women during pregnancy can have a condition known as preeclampsia.
Okay.
So in preeclampsia, you find that the women have high blood pressure. So like if a lady in their younger years, while they were pregnant, they had this preeclampsia, they're at a higher risk of getting hypertension at a later age, like 40, 50 years. Like
Okay.
my mother, an example.
Oh,
Yeah,
so she got high blood pressure at the age.
yeah. She had preeclampsia when she was pregnant, but she got diagnosed with hypertension at around 45 years.
Okay.
Yeah.
Also, if you're pregnant, you're at a risk of getting it.
Like if they diagnose you with that preeclampsia. Yes.
And is there a way that, let's say, for example, a woman who is pregnant can prevent it?
Not exactly. Not really. Yes. Not really. But if you have preeclampsia, it doesn't necessarily mean that you'll get the hypertension.
Okay.
Yeah.
So what are the chances? Because you said if you had it maybe in an early age when you're pregnant, once you're 40 and above, you are at a high risk of getting it. At what percentage with these people? Because I believe not everyone gets it. What percentage?
Like around 30.
Oh, 30%.
Yeah.
Okay, that is good. And of course, if you're out there and you feel you want to ask something about high blood pressure and hypertension, please feel free to text. Our numbers are officially open, 0711 176 006, and we'll be glad to answer those questions. Kama kuna ile swali unasikia, me, I want this question addressed, I want this question iende deeper, kuna zile vitu 2-3 sikuelewa vizuri, ama nilienda mahali kwa daktari na sikupata hijibu vizuri, and I want to get at least to what was shed some light on it. We are here for that. Make sure you're texting, and of course we're coming to you live on our Facebook page, that is the Oracle Television Network. Pale YouTube ni the Oracle Television Network. Daktari, I want us to talk about also diabetes, because it's also called a silent killer.
Yes.
And most people don't know when these diabetes usually happen. What happens to the body when somebody is being told that you are diabetic?
Okay, so in your body, for your body to function normally, for even to grow, from when you are 3 years old to now you're an adult, your body needs energy,
Yeah.
and energy is sugar. So in diabetes, the patient has uncontrolled elevated levels of sugars
Sugar.
in the blood, and this is harmful to the body. But sugar is not bad, but excess sugar is
It's bad.
Yes.
You know, when you're saying sugar, we tend to know, like, unaambiwa don't take too much sugar, you'll be diabetic. Does that mean that diabetes is brought by you taking consumption of too much sugar? This sugar that we know, leave now the sugar that brings energy in the body, is it brought by the normal sugar that we take?
Not really. Okay, so diabetes comes about because of many factors, even genetics. Like for the patients with diabetes type 1, they just have the diabetes, like they inherited it, not because they have an unhealthy lifestyle, they take too much sugar. No. So genes, a sedentary lifestyle, but diet definitely plays a major factor.
Diet.
Yeah.
Okay. So what are the types of diabetes?
I have type 1 and type 2. So type 1 commonly occurs in the younger people age gap, below 20 years of age. Type 2 occurs in the older generation, okay, for those the old people, yes, above 50 years. Type 1 is not influenced by like what you take. Like you just find you were born, and apparently at around 4 to 6 years, the baby, you're sick, you're taken to the hospital, they do the tests, random blood sugar, it's elevated. They do the definitive tests. We have what we call HbA1c. They find it's elevated, and they diagnose you as having diabetes. You know, you might find the child is even at 4 years. I don't think most children at 4 years, they like take a lot of junk or too much sugar. And these children also, you might find they have normal weight. But as for type 2 diabetes, people are obese, they don't like exercising. Yes, they have an unhealthy diet, junk, takeout, every lunch, and always takeout, fries, KFC, and you're not working out. It's very dangerous.
So type 2 diabetes mostly is brought by diet.
It's brought by diet and also not working out.
Okay. And what are the signs somebody should watch out for you to know that this is diabetes?
Okay, so for the initial symptoms, you might find a patient, a person goes maybe to the washroom to pee more than around 4 to 8 times. You always feel like peeing. At night also, a person, if you ask a person, they say, last night I couldn't even sleep, I'm always going to the bathroom. When you see a person whose toilet routine is interfering with their sleep, it means there's a problem there. Yes. So we term it as a polyuria. That's what we call it.
Okay.
Always frequently going to pee. Yes. So there's also what we call polyphagia and polydipsia. So polydipsia, you see, when a person is always going to the washroom to pee, definitely you're going to be thirsty. So this person, yes. So you find this person is always thirsty. No matter how much water they drink, it can't quench their thirst. They're always thirsty. Yes. And there's also the polyphagia. So people are also always hungry. No matter what they eat, they're hungry. And also fatigue. They're always saying they're tired. Yes. But other symptoms may come due to complications. A person may also have blurry vision. I can't see clearly. Yeah, can't see far, can't see well. Or numbness. Yes. And other patients may even present with an ulcer. If you've ever noticed this, the diabetic people, at least once in their lifetime, they have to have like an ulcer on their legs, leg ulcers.
Oh, the leg ulcer.
Yeah, like a leg ulcer that does not heal, a chronic leg ulcer. So like, you might find, yes, I got hurt, but I've been treating this leg ulcer for more than 3 months. The doctor is very concerned, and he orders the test for diabetes, and for sure you find some of them with diabetes. Yes.
And what are the dangers of having diabetes and not the uncontrolled diabetes? What are the dangers?
There's the visual problems. Then diabetes causes damage to the nerves, so we call it diabetic neuropathy. So because there is damage to the nerves, these patients cannot feel pain, and at sometimes they cannot even like detect maybe temperature changes. So even when they are burnt, they can't tell.
It is that serious.
It is that serious. They feel nothing.
Mm-hmm.
So like you might find their heart and they don't know. That's how also these chronic leg ulcers come about.
Oh, yeah.
And also these high blood sugars also damage the blood vessels. So you find even the blood reaching these ulcers, like it's hectic. It takes a while. So these leg ulcers take time to heal also. Yes, so you find they also have the chronic leg ulcers. And they also have issues with the kidney. Because they damage the blood vessels, they also damage the blood vessels that supply the kidneys. So they also have issues with kidneys.
Okay. And also, there's this myth that I had, and I wrote it, I want to read. It is said that if I feel fine, I don't need to check my blood sugar, my blood pressure, or blood sugar. Is that true, or it's just a myth?
That's just a myth.
Mm-hmm.
These conditions are asymptomatic. You need to go get screened, get checked, because you never know.
Mm-hmm.
Yes, a person might seem healthy, but when we measure your blood pressures, they're so high. Like there's a day I was with my mom and she had a cold, so I was taking her to the hospital. Triage, they say that her blood pressure it was around 210 over 98. And when you look at her, she's just there, she's laughing. She only has a cold. And that is very, very dangerous. She's laughing, she's eating, and you can't tell. You can't tell. So you need to go get screened, get checked.
And of course, there's this one. Can this disease be prevented? Because you said most of them are asymptomatic. And us being Africans, unless nime collapse, na unless I have felt like, sitasonga tena, unaambiwanga, ni kichwa tu. Wacha nipime. I see if tomorrow I'll be okay, I'll not go. How can I prevent it? Because there's that mentality and that notion that we already have, that until I feel like there's no other option for me, niende. Most of the time ni unapelekwa because you cannot go on yourself. How can we prevent it so that it cannot reach there and people get to know that you're not going to the hospital because you have it already, or you're not going to the hospital because you want to, you have that culture of you knowing, how is my health? How am I doing? How is my body? Do I need anything else so that my body will function well? So how can we prevent it?
First of all, I would employ people. Guys, have a healthy seeking health behavior. You need to care about yourself. You need to go for those checkups. You need to get screened. You need to know what's happening around your body. Because even if you're chasing that bag, you really, really, really need to take care of yourself. Health is wealth. You might go chasing that bag and then you find you have a stroke, or the money you have been saving. I know most people go through that. No one ever anticipates for a condition.
Yeah, true.
No one. So guys, invest in your health. Invest. No. You should really know your body. Go invest. Yes.
And what lifestyle changes that can somebody, or you can recommend for someone, and it will change their perspective completely?
Okay, so for hypertension, I can tell people try to restrict salt intake. You know, there are these guys who say, mi napendanga tu chumvi mingi. They're always asking for salt shakers. Nisidi chumvi. Chakula iko na chumvi. Mi initoshi. Excess salt is also very bad. Yeah, so you can limit salt intake. Exercise, it's really nice. Exercise. If you can't go to the gym, walk. If you can't walk, go swimming, do something.
Swimming also is important.
Yeah, it's really nice for cardio.
Mm-hmm.
Yeah, swimming, cycling. Yes.
Okay, so people to do exercises, they stop too much salt intake, too much salt intake.
And also limit the intake of alcohol, and if they can stop smoking, the better, because smoking also has a lot of complications that are like really bad. I have met patients who are around 60 years, 70 years, and they have really bad lung diseases.
They stop. Wow, and there's this question that has just come. This person is saying, I was told to stop junk eating, and also I am being told I need to be walking a lot, and I do not have time to go. What is another thing that I could do? Because mimi na gym hapana, ye hawezi tembea kwa sababu job yake anatoka usiku, na pia ameambiwa punguze junk. Ni kama anapenda junk sana. Sasa what exercise would do? Na yeye hawezi enda gym. Yeye anajijua kabisa gym na yeye hapana. What else would you tell this person to do?
Okay, there's also dancing. Dancing is enjoyable, and if you do it a day, like 30 to 40 minutes.
Dancing.
Dancing.
30 minutes.
Yes. It's cardio, and it's enjoyable. So like you're enjoying yourself, at the same time you're burning fat. Yes.
Okay. So start dancing 30 to 40 minutes. Ama ongeza ifike 1 hour and at least. That is every day or?
Okay, for the recommended amount of time that is advised is 150 minutes a week. So that's like 30 minutes, 5 days, for 5 days in a week. Yeah.
Okay. And what does the role of diet play in all this? Because we see, for you to have enough sugar in your blood, you have to intake something. For your blood pressure to increase, it means there is a diet somewhere. So how much is this diet playing the role in your body for you not to be, and what are the things that you should not take completely? Juu kuna zile unaambiwa, you can take this one will do this, you go to this other person anakuambia wachana na hiyo, nimepata ni mzuri sana. So how much is the diet part?
The diet is excuse me, very, very important. They said salt intake in hypertension for the diabetics, a balanced diet. You need to take a balanced diet, quarter plate carbs, quarter proteins, a quarter vitamins, and the minerals. Yes. You can add a little fiber there. Fiber is also very, very important.
Okay.
Yeah.
And how often should somebody go for checkup? Because for you to know your blood pressure and
Okay, so for the diet,
okay,
sorry to interrupt you.
it's well.
For the diet, I would advise also patients, it's not only salt. You can limit the intake of certain fruits like oranges also.
Oh,
Like if you are hypertensive, if you're not, don't.
okay.
Yes, and you can take foods that are rich in potassium, like bananas. Yes. For the diabetics, in the diet, we have foods that have what we call low glycemic index. So you see this food, when a person consumes this food, they take time to raise your blood sugar levels, as opposed to foods that have what we call a high glycemic index. They cause like sudden sugar spikes, like for junk for instance. Yes. So foods like pears, apples.
They
Yes.
take time.
They take time. Yes.
Oh,
Yes. So like if you're taking fruits if you're taking the fruits, you can also pair them with yogurt or nuts. Something that also like it increases the time that is required for the digestion. So you find that the blood sugars rise slowly.
Oh, yogurt take time
slowly.
also to
Digest. Yes, like it will help slow the process of digestion.
okay.
Like when you take it with the, when you take something with something. Yeah. Yes.
Okay. Okay, to the question, how often should somebody go for the checkup of blood sugar and diabetes? That is an adult, yeah.
Okay, so for diabetes, if you're just normal and you don't have a high risk of getting diabetes, let's say you're not obese, there's no one in the family with a family history, you're less than 40 years, around every 3 to 5 years.
3 to 5 years?
Yes.
Also, if I go today for blood sugar test,
Yeah.
I wait for 3 years again, so for me to go.
Yeah. If they said you're okay, yes. Yes.
Oh, this is not that unambwanga, you have to go, at least go check once in a year, eh?
That's for the high risk. Yes, like those people who are obese. There are people in your family with the diabetes. Even hypertensives are high risk people for diabetes.
Okay.
Yes.
Oh, so that means if somebody has high blood pressure, chances are high for this person to get diabetes.
They're at an increased chance, like they're more likely than the average person.
Okay.
Yes.
So if you're out there, umesikia at least once in 3 years surely, mara moja kwa miaka 3. It's just that you want to have a healthy living, you are making money and you're making wealth for you to enjoy the wealth. Unasikia Biblia inasema enjoy the wealth. We want you to enjoy that wealth very well. So that is why we usually bring in to make sure that umeenda uko check up, umeenda ukaangaliwa, and when you're going, don't just go alone. Jiambie together with my family. We want to have that transformation. We want to know what is the difference. Nataka kujua kwa nini. Usiende tu kujiangalia peke yako unajiambia yes, I'm okay, and then you're leaving your family there wondering what next should I do, ni nini ingine nafaa kufanya. Go get checked, go know what, and ukikuta uko nayo usishtuke sana, usiseme this is a death sentence, but there to ask on that. Does that mean that when somebody has high blood pressure or diabetes, this means this is a lifetime disease? Huyu mtu sasa yeye na madawa hadi God says come home.
Okay, so most people stay on medications, but under medical supervision, they can stop. But unless you're told by the doctor to stop. Yes.
So this means it's a lifetime disease.
Yes.
Or if you're diagnosed with it, ni wewe hadi mwisho.
Yes, but as I'm saying, you can find patients, like after a while, the blood pressure is normal maybe for like 6 months, but it all depends on your doctor. It's your doctor who will tell you, okay, so now I can see the blood pressures have normalized. It's the doctor who will tell you yes,
when to stop.
Yes.
And actually even after stopping you'll still be monitored.
Exactly.
Okay. So don't diagnose yourself and say right now nishaambiwa I'm not supposed to be taking medicines and this is what I'm supposed to be doing. Huyu mwingine anauliza, how is it a must for me to go to the qualified hospitals to get tested, or I can just do it on my clinic?
Okay. We have the screening test and the diagnostic test. For the screening, it's a fasting blood sugar levels, but there are others which you can't do on your own because it requires you to fast. They require you to fast for like 6 hours. So you have to go to the qualified healthcare facility. Yes.
Okay. So enda kwa daktari and you'll get that. Kuna ule mwana anauliza Is screening the best option, or health, or physical activity, or stress management? Because I feel like stress is increasing my blood pressure. So how do stress and blood pressure merge?
Okay, so stress and blood pressure merge in that there's a hormone. It's called cortisol. It's the stress hormone.
Okay.
So cortisol, being the stress hormone, it tends to, like, we say it's a fight or flight response. So it increases the rate of your heartbeat. So when it increases the rate of your heartbeat, obviously your heart is pumping harder, and when your heart is pumping harder, the pressure will definitely be higher. Yes. So yeah, stress also definitely contributes to high blood pressure.
Okay.
So it's a, how do I say this? It's many factors. I can't say it's only stress, because if it was only stress, I think a lot of people would have high blood pressure. But stress definitely does contribute greatly to high blood pressure. So I'd employ people, because stress is definitely unavoidable. Just find healthy ways to cope. Maybe you can do exercise. Exercise is really fantastic. You can exercise, you can journal, you can maybe go for walks. If you have money, you can go to a therapist. But I hear Madari is cheap consultation. I think around 500. So be budget that consultation fee. You go there. Yes, talk to a therapist, or you can even talk to your friend. But don't die with your problems. Don't be alone. Talk to people. Open up. Yes, we are here for you.
Yeah, hapo kwa we are here for you. Most people think the things is people get damaged, and this is why most reason that people put their stress inwards is they don't trust. Unakuja, I'll come and tell daktari 1 2 3, and then daktari aende ambie huyo mtu mwingine ajambia let me stay with it. But it is good for you to share. Hata akisema utakuwa ulishatoa. You know, the best part is you being healthy and you being alive, rather than having people who uko pale, you're having stress yourself. No, just say the way we are, the world that we're living right now, you're not talking, you're having stress too much. That stress in a pile up, inatoka kuwa good stress, inaenda inakuwa worse, the bad stress, and then it comes to depression. The next thing we hear, this person decided otherwise. Don't reach there. Just go to the, one thing I'm sure is when you go to health facilities, you'll get qualified medical doctors who will talk to, na mkimalizia wanasemanga kile kinafanyikia hapo inaishia hapo, haitoki nje, hamtawahi onana tena. So you pour out yourself out there. Tutaki ugonjeke. That is the good part of it. We do not want you getting sick. We don't want you to have that high blood pressure. We don't want you to have that diabetes. We want you to be healthy enough to take good care of your family, to achieve the goals that you want to achieve, to go to the countries that you've been desiring so much to go to. Imagine you've worked so much, and then ukitenda kufika ile time you want to live your life, you're not living that life anymore. That is not part of it. Kuna manasema, daktari, please, my leg is swollen and I don't know what exactly is happening to my leg. Does it mean that because I'm not feeling any pain, I'm having leg ulcers?
No, leg ulcers. An ulcer is, how do I, okay, in Swahili, kidonda. So for that person, I would advise you to go to the hospital. We can't diagnose ourselves. Yes, you go to the hospital, you see a doctor. A doctor will order some tests, and even for the lab and for imaging. I would advise people, guys, don't self-diagnose yourself. It is very, very dangerous. Those are the painkillers, you know. Nauma na kichwa yetu, tusikizie tu. Kumbe you have hypertension and you have a stroke. No, in stroke, there's this stroke, it's called hemorrhagic stroke. It's very, very bad. and it's normally caused by hypertension. So unasikianga tu kichwa unasema maybe sikulala vizuri, but leo imezidi, wacha tu niende niongeze tu Panadol. You will collapse, you will die. It's really bad. Was the hemorrhagic stroke, like if you go for days without it being detected and like treated early, you just die. It is really, really bad.
So for this person that you're saying, anafaa akuje at what time? The first time this person is having that headache?
Yes, especially like those throbbing headaches. It's very, very dangerous. Guys, don't self-diagnose yourself. Go to the hospital. It's very, very important. Yes.
And what complication can be brought by you not like having a good medication? Kwa sababu kuna ule mtu mwenye, this person who maybe they self-diagnosed themselves and then it became the good went to bad and the bad got to worse. For this person, how do you control it?
How do you control the diabetes?
Yes.
Diabetes, we have different approaches to the treatment. If you have diabetes 1, most of them are given insulin. Diabetes 2, you adopt a healthy lifestyle, work out, eat a balanced diet. You can at least reduce excessive caloric intake. And there's also anti-hyperglycemic medications they give you, oral. And at sometimes when your sugars are not controlled, they can also give you insulin. Yes, I would also advise hypertensives and diabetics, they should adhere to medication also. Yes, take your drugs.
I talk about that medication because most of the time if I start taking the medication and I start feeling like nilijidunga jana and now I'm feeling I am good, and I don't use it today, tomorrow I feel kuna kauchungu kwa umbali, I say let me continue from where I stopped. What are the dangers of you're being diagnosed, you take the medication today, you don't take it tomorrow, the next day you feel like I want to, you take it, you start again, you continue from where we stopped. What could happen?
If you're doing that, okay, if you're doing that, just know it's very, very wrong. You should stop and take your medication regularly, because like, for example, for the hypertensives, if you don't take your medication because you feel you're okay, it might reach a time when your blood pressures are so high. And you know, also the thing with kidney disease, it's normally asymptomatic. Unless they do the tests for your kidney function, you won't know that you have a problem with the kidney. And also kidney disease, it's not an easy condition also. So you find by the time this person is going to the hospital, you know, when we talk to patients, we ask them, ulikunywa dawa ya pressure lini? Nilikunywa last week. And you're like, these are the guys who present with very, 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 very high blood pressure and they have complications. Like, why did you stop taking your medication? Mimi nilikuwa tu nasikia niko sawa. Nilipima hiyo asubuhi na ilikuwa tu 122 over 80. Yeah, so guys, take your medication. Take your medication, because it leads to the complications which we had talked about faster, and you see it will be even harder to manage these complications
if you continue like that.
Yes.
Wow.
So if you're doing that, okay, now you know. So do better. For the diabetics also, when the sugars are so high, there's a condition, it's called hyperglycemic. It's HHS, let me say that in short. So it's a very dangerous condition and it's normally fatal. The diabetics, for patients with That's for patients with diabetes type 2. Diabetes type 1, patients may have what we call DKA, diabetic ketoacidosis. These two conditions, they are very, very fatal if not managed early. Yes, so like I implore you guys, take your medication. It's very, very important.
Wow. So the key thing is, once you're diagnosed with high blood pressure or diabetes, make sure you're taking your medication as directed by your doctor. Usijipee madawa ujiambie tani zenye nilipatiwa zimeisha, acha nijinunulie zingine. If you're told to buy that which the doctor directed you to buy, and do exactly as the doctor said, because we need you here today, we need you tomorrow, we need you to the next life. Uko mahali ambapo tunasikia the future is for the leaders. You are the leader of tomorrow. Kama ulizaliwa ukakuta wow niko nayo, just continue taking the medication, continue doing that which you are supposed to do. Wewe kama wewe unajiambia mimi, this is what I embrace it, and of course looking forward, what would God, of course, are there chances that somebody is healed completely na hatumi dawa tena?
Okay, medically speaking, I have not heard of such cases, so I can't comment on that. But normally they are chronic illnesses. I can't say someone is completely healed. Yes, you might find at times the blood pressure is normalized. Yes, the blood sugars are normalized, but that doesn't mean that the condition is gone. Yes.
Okay. So what is the message you'll want to give people? Maybe that message that you feel, ningetaka hii point, somebody to hear this point, and I have not spoken about it.
So high blood pressure and diabetes are very common conditions affecting millions and millions of people globally, not just in Kenya, everywhere. And they are asymptomatic. That's why we call them silent killers. Like, by the time people get diagnosed with these conditions, it's when people have serious complications. So guys, go get screened. These diseases are easily detectable, they're manageable, and they're preventable. Take care of yourself, guys.
Wow, take care of yourself. Watch out for yourself. You're important, you're valued, and of course, check your numbers, guys. Check your numbers. How well are you? Healthy? Uko healthy kwa kiwango gani? So check your numbers, check your family numbers, make sure everyone is on check, everyone is on point, and everyone has the good health that they deserve. And of course, as we are ending, I hope you've partnered with Oracle TV. It is very, very easy. It's very simple. Pale kwa paybill 171133, account is Oracle TV. Amount is any amount that God has enabled you to get, and you're feeling like, I want to become a blessing to this TV with 100,000, with 1 million. Ama unasema mimi hata sitaki nini, I just want to do direct bank transfer. Of course, you can call us on the numbers on your screen, and we'll be glad to give you the details and you do the transfer. But make sure every day when you wake up, when you're walking, when you're talking with your friends, tell them the good things about Oracle TV that you watch here. Tell them about the transformation you're getting from Oracle TV, and also tell them to partner as you are also partnering. Show them how you're partnering with us through the pay bill number, that is 171133, account Oracle TV, amount any amount. And of course, after we've done that, tuambie tu pale, I am a proud partner of Oracle TV. I am a family of Oracle TV. Kama ndo natujoin mara ya kwanza, say I am a new member of Oracle TV. I am a proud new partner of Oracle TV, and we'll be glad, so much glad to invite you to this other side. Unajua huku ndo side ya baraka, huku ndo side ambapo unapata mazao mema. This is where the future is. We not just say that, it is true. This is where the future is. And for us to bring qualified doctors, tukulete tu mtu yote, tulete madaktari kama hawa, is by you partnering with us, making sure that we are live on air every day, 24/7, every second, not moving from your screen. Unapata kila dakika, kila sekunde, na unapata kila kitu ambacho tunakifanya. Thank you so much for those who have commented. Thank you so much for those who have sent in their question, and thank you for being there and watching us live and making sure that we are here tukiendelea. Maybe daktari, your parting shot tukimalizia.
Get screened and take care of yourselves. Know your numbers.
Wow, know your numbers. Thank you for joining us. Thank you for being together with us. I've been your host, Revilla Luta. Make sure you get screened. Make sure you check your health, and make sure that you're checking the health of your neighbors also, and creating that awareness of how good it is us to have healthy living lifestyle. Until next time, same place, same time. I have been Revilla Luta. God bless you.